All right, good morning. Thank you everyone for joining us. I'm gonna give folks a couple of minutes to continue joining, but as we do that, I will cover just a couple of kind of housekeeping items for today's panel. So first of all, this session is being recorded and we will definitely share that out afterwards. So know that will be coming after the session through Carolina Engagement Week's channels. As everyone is joining, I welcome you to go ahead and introduce yourself in the chat. Just let us know quickly who you are, where you're zooming in from, maybe what brings you to this conversation, what your interest is in this conversation specifically. There will be a chance at the end of the session to ask questions, so I'll be keeping an eye on the chat if there's specific questions that pop up throughout to circle back to those or other reflections that you might want to share. The chat is open throughout the panel, so feel free to use that to engage with reflections that you may have or additional questions. This session is set up as a meeting rather than a Zoom webinar, so that means that it is possible to unmute. So please be sure to keep yourself on mute just throughout, so we don't have interactive kind of audio conflicts. And then at the end of the session, if there's folks that want to speak up and ask a question, that can happen. And then finally, there are CLE credits available for students that are participating. I will have a code to share at the end of the session. And if you have any questions about that, you can reach out to the Carolina Engagement Week organizers, Margaret Barrett and Macy Green. And if you're not able to find them, feel free to reach out to me and I can get you connected. So with that, I see a couple of introductions coming in. Thank you so much. Yeah, please continue to drop your introduction into the chat just so we know kind of who all is here. And I'm going to turn things over and sort of now that we're a little more settled, just start to get the conversation started and give you a more formal introduction of myself, who I am, why we're kind of gathered here today for this panel. So my name is Carolyn Freiberger. I'm the Assistant Director of Economic Development for NC Growth. We're based at UNC's Kenan Institute for Private Enterprise. And our center is really interested in building an economy with opportunities for all to prosper. We work across the Carolinas and beyond, engaging with people and places to increase economic opportunity. We're excited to host today's conversation with this phenomenal group of practitioners. Our work really began about 10 years ago with a focus on the northeastern part of the state, but it quickly grew to serve the whole state of North Carolina and into South Carolina. And as a Western North Carolina native myself, I was really excited when a couple of years ago, we really started to think more about how to deepen and expand our work in the far West. That thinking led us to get connected with Lizzie Cozart, who's based in Asheville. So hi, Lizzie. Good morning. How are you doing?
Morning. I'm doing great.
So good to see you. You've been such a phenomenal connector in this work, so I'm really excited that you're here to co-host this panel. And I'd love for you to introduce yourself and your roles at UNC.
Thanks, Carolyn. Good morning, everyone. And thank you for participating in this panel. My name is Lizzie Cozart, and since 2019, I've served in a hybrid role as the Western North Carolina fundraiser for UNC Chapel Hill and as the Director of Philanthropy at the Mountain Area Health Education Center, which is home to UNC's Branch Health Sciences campus in Asheville, known as UNC Health Sciences at Mayheck. I'm an Asheville native, a 2007 graduate from UNC, and I live in Asheville. Delighted to be here today.
Fantastic. And of course, today's conversation is part of this broader Carolina Engagement Week. Would you give us a little bit of kind of bigger context for this conversation? And why is it important? What is the importance of Carolina engaging in community across the state of North Carolina?
Sure. So I wanted to just take a moment to set the stage for our conversation this morning. We're going to talk about some powerful examples of what can happen when a university engages in deep partnerships with community. We believe the role of the flagship is to serve all of North Carolina, and the partnerships we will share exemplify some of the best of this institution. UNC teams are partnering with regional and community-based organizations to build capacity, based on Western North Carolina's needs across a wide range of teaching, research, and service initiatives. We strive to improve lives and solve complex problems. And part of our goal today is to create more space to share the work happening across schools so that we're not doing this work in silos, but in true partnership to serve community. We believe that real innovation and generational change requires the tapestry of partnerships that are interconnected and woven together to connect diverse experiences and disciplines that will meet the needs of the people in the region and our institutions. The more we create space to work across schools and initiatives, the more impactful we will be in service to our communities. I also want to say that we will not get to all of the work that UNC is doing in Western North Carolina in this hour, and humbly acknowledge that we do not know the full extent of the work that others at UNC are doing in the region. And in fact, we hope you will connect with us in the future if you have work or ideas about engagement in the region. I now want to present our wonderful panelists and invite them to give their introductions, starting with Dr. Susan Mims.
Good morning. It's wonderful to be here. Thank you, Lizzie. I'm Susan Mims. I serve as the president CEO of the Dogwood Health Trust, located in Nashville, but serving Western North Carolina. And I am a Tar Heel through and through for all my graduate education. I got my master's in public health and my MD at UNC, and did all my medical training there and my preventive medicine. So I just love talking about these partnerships and really look forward to this conversation this morning.
Thank you, Dr. Mims. And next I'm going to ask Molly to make your introduction, and I'm going to add you to the spotlight here.
Sure. Good morning, everyone. My name is Molly Scott, and I am Regional Associate Dean for UNC Eshelman School of Pharmacy and oversee our regional campus for the pharmacy school here in Asheville. I have the pleasure of serving in a dual role, so I'm also chair of pharmacotherapy at Mountain Airy Health Education Center. I'm a pharmacist and practice at Mayhag as well, and work with our students and residents from a multitude of disciplines, including medicine, public health, dentistry, so on and so forth, nursing students sometimes as well. And I'm an Asheville native, also a UNC alum. So I attended the School of Pharmacy back in 1993. So it's my 30th reunion year this year. And I'm very excited to be here with you to talk about everything that's happening in Western North Carolina around healthcare education.
Fantastic. And Lauren.
Awesome. Thanks, Carolyn. Nice to meet everyone this morning, and thanks for having us. I'm Lauren Flickinger. I am the fund manager for the PISGA Fund, which is a venture capital fund investing in healthcare startups in Western North Carolina. We're a unique entity, and I'll get into more of what we're doing. I'm excited to share that with you all. But I am an Asheville native as well. There's several of us on the call, and also a Kenan-Flagler alum. I went to business school at UNC, met my husband there. And really am enjoying being back in my hometown, getting this opportunity to put finance skills to work, thinking about investing in the community in Western North Carolina. So it's great to be here with you all.
Thank you, Lauren. Yeah, a bunch of Asheville natives here, and Lizzie and Lauren and I actually all went to Asheville High around the same time. So go Cougars. And yeah, it's really fun to get to reconnect in this way at this time, and really bringing skills and kind of experiences back into the region. So it's been a lot of fun to work and connect with all of you. Before we really get into the specifics of the programs and partnerships that each of our panelists are engaged with, I'm going to kind of give further framing to this conversation, really focusing us on how UNC is working to build an economy that cares for all in Western North Carolina. This work is really happening at the intersection of many issues and disciplines, but thinking, when we think from the perspective of an individual community member, it's easy to recognize it's hard to make healthy choices if you don't have access to a good job or a steady source of income. It's hard to keep a good job if you don't have access to housing. These individual struggles and choices really compound at the community and the regional level. Regions can't be competitive in attracting and growing businesses without a well-trained and healthy workforce. And so all of this rests on the social determinants of health model, which is a model and a set of terminology that's really well known in public health circles. But we wanted to be intentional about defining that, since it's not used across all disciplines. And we're not all coming to this conversation, from the same place with the same set of terms. So having common definitions really allows us to work together to problem solve and create change on issues that require an interdisciplinary approach. So Dr. Mims is going to take us to school, as Lizzie's been saying in preparation for this conversation. She's going to dive a little deeper and give us really an overview of the social determinants of health and how this model informs Dogwood Health Trust's work to really create a Western North Carolina where everyone can live, learn, earn, and thrive. So Dr. Mims, if you'd like to go ahead and share your screen, the floor is yours.
Okay, well, I'll just start. I'll share my screen just a minute. I will say this is going to be a very short class. It's not because I want the wonderful discussion we're going to have. But I do, I mentioned my medical background and training as practicing as a pediatrician. It didn't take long for me to see that I could, diagnose, write a prescription. And I was, serving an underserved population. And if, just as Carolyn said, if folks are struggling to be able to stay in their home and worried about getting evicted or not knowing kind of how to get food, especially healthy food, or don't live in a place where it's safe to get outside, it's very hard to really get to true health and well-being. And so I quickly moved into the public health side because I felt like that population focus is really what's needed to get to health. And that's why I'm so thrilled to be able to work at Dogwood Health Trust, where as our name says, we're a health trust, but we're really focusing on what are often called the social determinants of health. And those are, we focus on housing, education, economic opportunity, as well as access to health and wellness activities. Let's see, I'm going to share my screen now and just a quick slide that shows what I was describing. I was in this bottom 20% in the healthcare delivery. And I do think it's interesting to point out that as a nation, when we fund healthcare, what the money we put into health, the vast majority in the high 90% goes into that 20% of healthcare delivery. And so these other factors that are either called the social determinants of health or often called the social drivers of health and well-being, make up 80% of what makes us healthy. And they are the, what we come into the world, how we come into the world, where we live, the environment, how we live, all of those things really contribute to our health and well-being and are often underappreciated, I think under-recognized and clearly underfunded. And you can see these things when we talk about health, many of these fall outside of the healthcare sector. And so this really requires for us to address this across sector conversations and work like we're having today. Let's see, just to dive a little bit deeper, there are many definitions of this. The CDC defines this and has a big focus. Internationally, there's also a big focus on considering all of these social drivers of health. And they really are the complex social structures and ecosystems that shape our lives, including being connected to each other and having the space and place to have that connection that we as humans need. Getting education for a fulfilling way to live our lives and earn a living, and having that resilience to overcome the stresses and trauma that many and almost all of us face at some point. And I mentioned, healthy food, transportation, and access to care. This is not a comprehensive list of the social drivers of health. There are many more, and many are being recognized now as other social drivers that affect certain populations, especially people of color, people who are differently abled, people with different identities. And those things also factor into how people live to maximal health and well-being. So with that kind of ground setting, I will turn it back over to Carolyn.
Thank you so much, Dr. Mims. With that in mind, our panelists are now going to kind of dive deep into the work that they're involved in that really exemplifies UNC's work in Western North Carolina at this intersection of economic development and health. And hopefully that also gives us all kind of an understanding of why we are all at this panel today and why it's important for all these different elements to be in conversation with each other. And so these, efforts are happening across teaching, research, and service. And all of this really is undergirding UNC's service to the state as a whole. So with that, Molly, would you get us started?
Sure, I'd be happy to. The University of North Carolina has had health science students learning, practicing alongside physicians and pharmacists and nurses, learning to become clinicians since the AHEC system began back in the 1970s. And so over the past decade, we've really had the opportunity to strengthen our health education relationship with UNC Chapel Hill and Western North Carolina. And a lot of that has been driven by the amazing place that Western North Carolina is in terms of its beauty, its healthcare needs that Susan outlined, and our fantastic teachers and preceptors that are teaching our learners here. So UNC Health Sciences at Mayhack was established about 5 or 6 years ago to bring together UNC School of Medicine, Eshelman School of Pharmacy, Adams School of Dentistry, and then also Gillings School of Public Health to really establish this branch of a health sciences campus in Western North Carolina. And our space is on the beautiful campus of Mayhack. And then we also have some lovely space with UNC Asheville as well. So those partnerships have been very, very important. And so I wanted to share a little bit with you about the different schools and some of the work that's happening up here. The School of Medicine started in 2009 and now has over 30 students who are training. In fact, the second years just arrived here last week, and I had the pleasure of greeting them as they're participating in their training. All of these students have a rural rotation, and many of them are also part of the Kenan Rural Scholars Program that is exciting students to become primary care providers after graduation and to serve small and rural underserved communities. The School of Pharmacy started in 2011, and we have capacity for 20 students to spend 3 years of their education here in Asheville. As part of that program, we too have a Rural Scholars Program that's led by Stephanie Kaiser, and she talked about the work that she's doing in rural health several days ago as part of Engagement Week. And the vast majority of the students who go through that program are serving in rural and underserved communities in Western North Carolina, but also across the country as they gain that love for service and for caring for rural communities. We also have a new ambulatory care scholars program with the School of Pharmacy, which is teaching our students how to serve as an embedded pharmacist in a primary care clinic. The relationship between physicians and pharmacists is really powerful as we work together to take care of patients and then have the rest of the team members around us to help focus on those social drivers, as Susan talked about. And that's a great model of practice in Western North Carolina. And so we wanted to teach our students about that rather than waiting to pharmacy residency. The MPH partnership here in Western North Carolina has been very powerful and impactful as well. And it's a partnership with Gillings, with UNC Asheville, and with Mayhack. And so we have students that are getting their MPH here in Western North Carolina. A lot of them are working professionals. And so far we've graduated 47 students from this program, and it's a joint degree between UNC Asheville and UNC Chapel Hill. And then finally, I'd be remiss if I didn't mention the dental school. They have a rural program as well. And so the dental students come up and work in rural Western North Carolina. And 15 graduates of that program, 9 are practicing in rural areas. So we're really having terrific success of having students train in Western North Carolina and then seeking to practice in rural communities. And in addition to teaching, we've helped to build out the research capacity here in Western North Carolina. At the School of Pharmacy, we have researchers from the Division of Pharmaceutical Outcomes and Policy that are focusing on substance use disorder, focusing on caring for underserved communities. We have a strong emphasis on geriatric care because we have an older population here in Western North Carolina and a shortage of geriatric practitioners. We're also doing some work around increasing access to reproductive health services by some new legislation where pharmacists can initiate contraception in community pharmacies. And so we're working on that in partnership with the Duke Endowment. MAHAC has started its own institutional review board to help support the research programs that are happening here in the region and has a new Office of Sponsored Programs, also a new MAHAC research certificate to help our learners and young researchers further develop their research skills because we're studying and trying to solve those really tricky problems in the region, particularly things around, as I mentioned, the aging population, substance use disorder, reproductive health. And then one of our additional areas that I wanted to focus on is we're working to build the pipeline of healthcare practitioners. One of the things that UNC Health Sciences at MAHAC really wants to do and is focused on is recruiting, training, and retaining Western North Carolina natives. We know that folks often love to stay where they grew up and practice. You can see that from our panel today. So many of us are Asheville natives and we're somewhere else for a while before we came back home. The mountains called us home. And so we do have pathway programs for high school students and also college students, internships where we can teach them about rural underserved care and hopefully get them into one of our academic programs and have them stay and serve Western North Carolina or to serve other areas in North Carolina that are in need. So those are just some of the things that we're focused on with UNC Health Sciences at MAHAC, our emphasis on education, research, service, teaching. It's a great place to be. Our students really enjoy being here and love the Carolina identity while also connecting with Western North Carolina and having that mountain identity as well.
Thank you, Molly. The work, that you speak to, it's such an asset to the Western North Carolina region, but we also heard throughout your description kind of how your work is impacting the way that Carolina works as a whole and impacting other regions in terms of demonstrating how this can be done, training people that are not necessarily staying in Western North Carolina, but going into other places that have a similar context. So thank you so much for that deep dive and for all the work that you do. Lauren, I'm going to pass it to you next to really give us a deep dive on the Pisgah Fund.
Yeah, thanks, Carolyn. So the Pisgah Fund is a $50 million fund investing in in early stage healthcare startups that are either in Western North Carolina, would bring jobs to the region or benefit to the region as a result of our investment. And healthcare startups, we define broadly and include social determinants of health. So any company that is also addressing more broadly those social determinants that Susan described already fall in our purview. For anyone familiar with venture capital, if you're not familiar with venture capital is kind of a slice of when you're thinking about financing for a company that is looking to invest in early stage companies, but have a great potential for high growth. So we're not funding small businesses. We're not funding later stage companies that have, are generating revenue and stable. We're kind of in this sweet spot of companies that are just getting off the ground, but really trying to be game changers in the industry and disrupt the industry. And the fact that we have this very large, $50 million for Western North Carolina is frankly a very large fund for the size of our region to think about investing that amount of capital here. So we're both looking to invest in companies that have started in Western North Carolina, but also that might come to our region to bring jobs to the region and to benefit the patient population, the folks that live in Western North Carolina in some meaningful way. And it's really, so I want to give a little bit of background on how the Pisgah Fund came together, because it is quite a unique entity for the region, but for venture capital more broadly. We're different than a traditional venture capital fund, which typically have a lot of passive, what we call passive limited partners. Here we have two strategic partners, one of which is the Dogwood Health Trust. So the Dogwood Health Trust, Susan will get into it a lot more right after me, but we're coming from importantly from the investing side of Dogwood. So to earn a return for Dogwood so that we can regenerate the capital so they have more funds to deploy in the region. The other side of our partnership is from HCA, which is the large hospital system that owns Mission Health. Many of you might be familiar with the fact that HCA acquired our hospital system here in Western North Carolina several years ago. And so we have this unique partnership with both the foundation that is serving our region, as well as the largest hospital system in the country, where we can think about scaling startups, healthcare startups in our region to grow at a national level. We are managed, and so I'm the fund manager for the Pisgah Fund. I work for Hatteras Venture Partners, which for any of you sitting in Chapel Hill is in your neck of the woods. Hatteras is a well-known VC fund based out of Durham that has been investing in healthcare startups across North Carolina, the Southeast, and nationally for over 20 years. Just closed on its 7th fund. And this partnership with Hatteras for Pisgah is really, really important as we think about kind of how to really scale and mature companies and provide the network and expertise that they will need to be successful being in North Carolina, in Western North Carolina, but scaling more broadly. So we have access to all kind of the expertise, operating expertise, network that comes from the Hatteras team. Hatteras also has connectivity to Carolina, managing the Carolina Research Ventures Fund. If any of you are familiar with CRV, that's more on the life sciences side, but lots of connectivity between Hatteras and UNC, separate from Pisgah. But as I'm sitting here, and Pisgah is a relatively new fund. We've been at this for about 2 years now. As we're sitting here thinking about where is the opportunity to build companies that start in Western North Carolina, I can't go any further than thinking about Mayhec and UNC Health Sciences at Mayhec, and where there is an opportunity to think about the same thing that happens at Chapel Hill in terms of the translation, in terms of technology translation from the research side into companies that happens on the main campus. UNC Health Sciences feels like this really, really exciting incubation point for the opportunities that would specifically address challenges in our region. And I think specifically, and you heard Molly Scott talk about this already, in terms of everything that UNC Health Sciences is doing around rural health, there's this real opportunity to think about applying technologies and applying research that is addressing rural health, and no better place to test some of those assumptions and kind of work out where a company might play in addressing some of those needs than partnering with our team here at UNC Health Sciences at Mayhec. So one specific example of this that we recently have worked through with the Eshleman Institute for Innovation is the First in Venture Studio. They've run this First in Venture Studio process at Carolina, I believe, twice on the main campus, and we've just run the process now here at Mayhec this fall. It's the first time the Venture Studio has gone outside of Chapel Hill. And what the process is, for any of you who aren't familiar, this is something that the Eshleman Institute runs, and are basically looking to incubate companies that have come from some idea generated at UNC. And where we took this process in Western North Carolina was frankly around one of the thorniest issues around substance use disorder, and getting the folks here at Mayhec who are really national level experts on how substance use disorder is affecting rural communities to work with the Venture Studio folks and think through this problem, and where, again, kind of with a focus on, there's many places that public dollars and public support is required here, but where might a private company play in this space to address this issue? And it's been an incredibly illuminating process, has gotten a lot of energy from both clinicians and folks on the innovation side, and some really, really exciting ideas. Two potential company ideas were just pitched a few weeks ago, and they're working towards an investment memorandum. So we at Pisgah are just incredibly excited. I think we're at the early stages of what this partnership with UNC Health Sciences and Mayhec can mean in terms of innovation in Western North Carolina.
Fantastic. Thank you, Lauren. It's really cool to see how these pieces are sort of coming together and amplifying each other, the private sector, the philanthropic efforts, and then university work. So really appreciate all the work that you're doing, Lauren. And Susan, I'm going to pass it to you next to really dive into more about Dogwood Health Trust and your role in the region.
Great. Yeah, there's just so much to talk about. And I love, what Lauren was talking about. We've had the opportunity to kind of be involved with addressing the opioid epidemic and some really exciting things with UNC Health Sciences. And we've also had a wonderful opportunity to just connect the expertise from, Chapel Hill and with the expertise and really the way Western North Carolina comes together to solve thorny problems and work together, and bringing all that together is going to help us be more successful. And so at Dogwood Health Trust, I mentioned we are a health trust, and I think Lauren mentioned we were created with the sale of the Mission Health System, which was the largest regional system in Western North Carolina. And so the asset that was, the purchase price went to create this foundation, which exists to serve the 18 counties and the Qualla boundary of the Eastern Band in Western North Carolina. So we've been deeply listening to the community to understand what are the most difficult challenges and where we need to focus. And from that, we have really learned of so many opportunities. And I'm just going to highlight a few of the examples, and this is not exhaustive by any means, of where we have been partnering with UNC to work on these problems that we've heard from the community. We've just had our first cohort of 10 organizations that have come together to work on early childhood education. We know that that is one of the top needs. The early childhood workforce is the workforce behind the workforce. And so there's not much that can happen if people don't have quality childcare and education for their children. So in partnership with the Frank Porter Graham, UNC's Frank Porter Graham Child Development Institute, we have 10 organizations. It's really, they're all different sizes, all different focuses coming together to work on one of 3 aspects of addressing the early childhood workforce crisis. And one is getting more educators credentialed so that they can move up and actually get better pay, which helps keep them doing what they're doing, improving the working conditions, and bringing also, so people will stay, and then thinking about that pipeline and both working to get folks coming up, younger students, exposure, mentoring, and support to enter the workforce, as well as thinking about folks who are changing their career and want to, may have been at home, they've been doing different things and want to enter this workforce, and support for that. And one of the really exciting things in parts of this collaborative is the expertise that Dr. Aruka brings in the, we have a Start with Equity Academy that's really founded off of her work in creating the Institute's Equity Research Action Coalition. And so it's just been an incredible, valuable partnership to cultivate a stronger system for early learning in Western North Carolina. So we look forward to seeing that progress, and we're going to add another cohort coming up. Another example that's also in the education realm is in NC Impact, and that work is led by Professor Anita Brown-Graham, and is work across all of the counties, and we have been able to partner to bring that to Western North Carolina with the NC Impact initiative. This is a partnership with UNC School of Government and My Future NC that is really working to get post-secondary credentials, get more people to attain those credentials so that they can secure a living wage and be able to have support their families. And this will create 4 educational attainment collaboratives is part of the My Future NC network across Western North Carolina, and really build that education to career continuum that really helps them get the skills and get those higher paying jobs. And the last example I'll highlight is the NC Growth. And I think Carolyn may talk more about this, but it's just a wonderful collaboration. And we talk about that cross-sector work and how important it is for different organizations who may not have been talking to each other before to come together. And this is with UNC's Economic Development Center, NC Growth, and the Southwestern Commission, which is our council on government for the far western counties of Western North Carolina, along with Western Carolina University and Mountain True, to get direct technical assistance and capacity building to businesses, local governments, and leverage additional dollars into our region. So there's so many more examples I can share, but I'll stop there and turn it back over to Carolyn.
Thank you so much, Dr. Mims. Yeah, and I'm going to take off my moderator hat now and become a panelist of sorts. So to talk a bit more about the work of NC Growth, as Dr. Mims mentioned, we did receive funding from Dogwood Health Trust to really help us deepen and expand into the far west. NC Growth, our goal is really to help businesses and communities create good jobs and equitable opportunities to really increase access to economic prosperity and shared prosperity for all. So our work primarily involves providing direct technical assistance, and in doing that, we're kind of connecting the dots of some of these higher level conversations down to specific businesses and specific local governments, making sure that they're able to take advantage of these opportunities, that they are ready, and have the capacity to receive new investment, and also making sure that they have a sense of their region's goals, so they know how they want to grow. So just some examples of project work that we do kind of across the state. We might work directly with a business owner that's hoping to grow. We work with any size company, but kind of our sweet spot is existing companies that have, say, between 5 and 100 employees. We might work with them to write a business plan, develop a marketing strategy, conduct some kind of financial analysis, really whatever do they need operationally to be able to move forward, maybe interact with a new funder, like the Pisgah Fund and Hatteras Venture Partners, or to be able to approach a bank for new funding, whatever that might be, to help them grow and expand and hire more people from their community. And then we also work directly with folks in the economic development space. So that could be local governments, towns, counties, tribal governments, regional government associations like the COGS. So as Dr. Mims mentioned, the Southwestern Commission is one of our key partners in the Western North Carolina region. And on those projects, we tend to look more directly at what are the strategies that this place can employ to help create an environment for business development, to leverage their unique assets for growth, and really just ensuring that the people in that place have access to economic opportunity. And so often that means just kind of pulling all of these different pieces together in a specific place. So I guess it was the fall of 2022, we hired a program manager who's now based in Southwestern North Carolina. He's based in Franklin in Macon County. He is on the call today. I saw him in the chat. His name's Stacy Guffey. He is a Macon County native and really has a deep understanding of these issues and is able to leverage that into serving the region. And our model, similarly, we have a program manager who's based in Eastern North Carolina in Bertie County. We also have a program manager based in the Low Country of South Carolina. So we're really interested in having a direct presence in community to make sure that the work that we're doing is, responding to the needs on the ground, but also providing that connection back up to these state level resources and making sure that these cross-sector connections are happening. So we work both with private sector and public sector clients, which enables us to really see the connections and the ways that these entities can work together for success in a region. So that's a bit about us and the work that we're doing in Southwestern North Carolina. We, some of our key partners in that, as were mentioned, Western Carolina University, but also the Eastern Band of the Cherokee, and the Southwestern Commission, of course, being key. So delighted to be working with all of you and have the support of Dogwood Health Trust in doing this work. So I'm going to shift us now. We've got about 20 minutes left together this morning. I'm going to shift us to kind of some more general questions about this work. And, at this point, for folks that are listening, if you've had questions or reflections coming up, just a reminder to drop those in the chat, and I can weave those in as we move along. So just kind of to start off with a broad question, what are some of the major gaps or opportunities that you see, kind of from your vantage point, in creating an economy that cares for all in Western North Carolina? And Lauren, I'm going to pass this to you to start us off.
Great. Well, it's a big question, Carolyn.
Yeah.
I think I want to kind of come at it a little bit from my vantage point of kind of where we see the opportunity with Pisgah and who we're partnering with in the region. And I think the two lenses that I look at that when thinking about the economy in Western North Carolina, I again immediately go to our rural communities outside of, and so when for those not in Western North Carolina, we're really talking about outside of Asheville, and how do we kind of, the economy is very connected. Many people drive into Asheville and go back out to many of the rural communities, but also thinking about supporting the communities where folks want to live and work outside of the Asheville metro area. And two things to me feel really important for that. One, there have to be jobs for people to do. And if people want to live and work there, they have to have good health care. You think about what makes someone want to live in a community, and you don't have access to health care, that is a real barrier to your desire to live in a community. And we can talk about education and housing too, and I'll let Susan kind of talk about the whole realm of these things. But within healthcare and economic opportunity, staying in those two lanes, I think there is real opportunity for us to really imagine how to improve rural access to healthcare through technology. I think it's a true opportunity to kind of think about, we want people to be in community, but it doesn't always make sense given the population density. And how can we leverage technology to make sure you're getting the same access to good healthcare, whether you're living in Asheville or whether you're living in Franklin? I see great opportunity for technology in partnership with everything that the physicians are doing to provide good healthcare, to kind of marry those two and improve rural access. On the economic opportunity side, I think, and Carolyn, I love following you here, because I think when we think of traditional economic development, it's often in the sense of bringing in a big employer who's going to bring a plant and bring tons of jobs, and that is a really important aspect. I'm not knocking that. Like those are real, very good jobs, and we have a great example of that, having Pratt Whitney bring 750 jobs to our region. But there's also this other big swath of opportunity when we think about supporting small businesses and supporting the growth of companies that can start small but scale into something much bigger. And I think access to financing for those types of companies is a lot more challenging. Whether it's, even for us sitting here as venture capital, we have a mandate to return capital to investors that often is a threshold that is too high for many small businesses and folks just getting off the ground to meet. So I think there's a real opportunity for kind of earlier stage funding resources, thinking of working together across what I kind of say across the capital stack, from non-dilutive grant funding to supporting small businesses, and everybody kind of being in dialogue with one another to think about what is the right place for this company to be pointed, so that they can get the support and resources they need to be successful. And there's a lot of really important work around kind of that capital needs assessment in our region. Again, that's being led by Dogwood, to bring all the funding partners together to support our small businesses and early stage businesses, in addition to those that are well established, because frankly, all of them provide jobs and are important for the economic growth of the region.
Absolutely. Yeah, that's a great point. Dr. Mims, did you want to jump in on this one?
Sure. I think that just that infrastructure that Lauren's referring to is so important. We know that we have this changing demographic in Western North Carolina. We have a beautiful landscape, and lots of people want to be here and appreciate the mountains. And we've seen, more people moving here, and we also know that and some of that has led to a real crisis around affordable housing. We know that for everyone who's here, and everyone who is here, whether they're in the service industry or, working in schools, our bus drivers, our early childhood educators, it's very, very hard to have an affordable place to live. And so that is one of the focus areas that really supports every sector. And so we know that, that in the workforce shortages that we've seen, we need to have folks focusing on the construction trades to be able to ensure we can build the housing and finance that housing. So one of the things, Dogwood, we're working to bring some of the federal resources in to maximize that affordable housing, and keep looking at keeping affordable housing in circulation and having it not, convert to market. And doing that in conjunction with other sectors, like I mentioned, in housing or workforce. We're working with UNC Health Sciences on workforce housing for the health professions who need to be out in rural areas so that they can have that opportunity. So there are lots of pressing issues that are very solvable if we come together and we think about, okay, how can we, pilot something like Lauren was saying and get something started like we're doing in these examples. And then what else how can we bring our voices together where we need advocacy and policy changes to make them sustainable? So lots of in that area.
And I'm so glad that you mentioned the housing issue specifically, Dr. Mims, because it is so foundational. And I know our team has been part of a partnership with NC Impact recently, looking at doing some research around the labor shortage and having conversations out in Western North Carolina. And that has come up as a strong barrier to participation in the labor force from the individual side. And, it's something that perhaps I think could easily be segmented out as like, oh, that's a different issue. But the fact that people are thinking about this in context, and we have all these different players thinking about this issue is really important for the region. So yeah, very glad that you raised that point specifically. Thinking about and kind of turning to the theme of this week, Carolina Engagement Week, thinking about partnerships specifically, what partnerships have been key for your work or for the issues that you're working in, both within and across UNC, but also outside of, whether those are community-based entities or other state level entities, whatever it may be. If you can just speak to those. And Molly, I'll pass this to you first.
Sure. I think we could not do the work that we're doing at UNC Health Sciences at Mayhack without strong partners. It's been critical to our success, and listening to the needs of the community, and then coming up with strategies to meet those needs collaboratively with community leaders is an important thing for all of us to be doing. So I had a couple that I wanted to highlight. I think you can't have a strong health education program without a strong medical institution. And so our relationship with Mission Health has been key to the work that we're doing for decades. And so Our health science students train there. We have preceptors there from a variety of disciplines who are, helping them learn how to be clinicians. And over the past several years, our collaborations have grown. So thinking about the medical residencies at Mayhack, I'll use that as an example. Historically, we've had family medicine and OB for many years. And so with the partnerships with UNC Health Sciences at Mayhack and then with Mission Health, there are new residency programs now in internal medicine, in psychiatry, and in surgery to help meet the healthcare needs of rural communities that often don't have primary care, often don't have specialists. And so they're a really important partner for us. I also think we need strong relationships with our sister schools within the UNC system. And that's been really fun, incredible work to collaborate with UNC Asheville, with Western Carolina, and with Appalachian State. And so we have new early assurance programs at the School of Pharmacy, where students who are at those three schools can interview early for a seat in pharmacy school, go ahead and have assurance of that seat and receive mentoring and support from their home institution, as well as from UNC Eshelman School of Pharmacy as they prepare to become a pharmacist. And so we have our first early assurance students coming to Carolina this year from Appalachian State. And we have some in the pipeline with Western. Our UNC Asheville partnership's a little bit earlier. And that's also happening in the eastern part of the state. So working with our schools within the system to find great and talented students who maybe just need support or encouragement to envision themselves receiving a Carolina education in the future has helped us with our pipeline program. And then one that's kind of boots on the ground that I wanted to mention, we've done a lot of partnerships with ABCCM here in Western North Carolina, and that's Asheville Buncombe Community Christian Ministry. And they are serving the needs of the most vulnerable people in Western North Carolina. They have clinics, they have dental clinics, they have sustainable housing for women and children who are experiencing homelessness, also service for veterans. And so our faculty, our students, our residents often volunteer within that organization because we know that we can't solve all the issues around healthcare. I think this is the theme for today, without also thinking about, do you have heat? Do you have food? Do you have clothes? Do you have a place to live? And so partnering with that organization has been valuable for our learners and faculty, and also has helped those organizations as well achieve some of the goals that they have. So that's been a really valuable partnership for us.
Fantastic. Thank you. Dr. Mims, would you like to add to this one?
Sure, yes. So there are, I think the partnerships, like we said, I think the theme of this is partnerships and cross-sector collaboration. We have had the privilege to invest in collaborative efforts with UNC and the Western North Carolina Health Network that is working with Mayhack's rural teaching practices and our FQHCs, which is just touches every aspect of Western North Carolina. Working on, I mentioned that, while we talk about the social determinants and housing and education, it's also a social driver to have access to high quality whole person integrated care. And to ensure that that is distributed in an equitable way. And so this partnership is focused on facilitating optimal medication use and equitable medication access to chronic care management, and is a great partnership across all these delivery systems that really have can reach the rural areas of all areas of Western North Carolina. And there's so many more. We talked about the opioid epidemic that's hit Western North Carolina just so hard, and coming together to think about creative ways to address those. UNC Health Sciences has been an incredible partner, along with, as Molly said, all of the learners, that are part of NAHEC, to have these bright minds thinking about creative ways, such as the, initiating treatment at the point of overdose with an EMS unit right there, and then linking directly, like, here's your appointment to go see your NAHEC doctor. So you've got your meds, you've got a place, instead of just giving, a reversal to the overdose and saying, okay, be on your way. That's not doing anything. So these kinds of creative partnerships are really making an impact in the middle in Western North Carolina.
Fantastic. Yeah, Lauren.
Yeah, I guess I just wanted to add and kind of frame, not add and describe further partnerships, because I think we've described those well, but as I'm listening to everything that Molly and Dr. Mims are sharing, I think it's important to recognize that these challenges are not just challenges facing Western North Carolina. We're talking about challenges facing rural communities across America, frankly, and I think we have this real opportunity, or it's not just an opportunity, we're doing it, of through these cross-sector interconnected partnerships to think about solving these problems differently and thinking about them holistically. And that's where I really see this partnership with UNC as key, because it's kind of taking the boots on the ground work of people who are in and out every day working to solve these challenges and connecting them with faculty members and students who are thinking about these problems at a systems level to really enact and make change. And we've got these with UNC, with Dogwood Health Trust, with the graduate medical education that are coming through UNC Health Sciences, and all of our partners in the region that everybody has done such a good job connecting to this real opportunity to continue to dive deeper into how do we think about, again, back to your question, Carolyn, how do we make the economy care for everyone, not just in Western North Carolina, but in rural communities across North Carolina and across the country, because these are thorny issues that we're not the only ones facing them. So I think it's important to recognize that this isn't just figuring out how we're serving Western North Carolina population. I think we are doing something really, really special here that we really need to be talking about outside of just our region and in Chapel Hill and elsewhere, because we're proving that these models work differently and can, if we think about social health on top of just healthcare in the medical sense, there is a way to really improve health and well-being for folks everywhere. So I'm just very energized to listen to everyone, to listen to Dr. Mims and Molly and you, Carolyn, talk about these things, because we're doing something really special in Western North Carolina.
I just hop on that, Lauren. I'm so glad you brought that up, because I do think that sometimes we get our head, folks doing the work are just so focused on doing the work and don't think about telling others about really cool things that are developing. And so having a large research institution connected to this work really kind of broadens how that very important sharing and replication of what is working and learning from what is not working can happen. That's a great point.
Fantastic. Well, these are really wonderful kind of concluding points, and I can see, Lizzie, I think you're ready to jump in and sort of take us home here. We just have a couple of minutes left, and I will share that slide at the end with the QR code for the CLE credits for everybody, so please stay on the line. But Lizzie, if you would close us out.
Yeah, thanks, Carolyn. I just wanted to take a couple minutes and sort of wrap us up and thank our panelists again, and for everybody on the call. And most of all, thanks to the people who are doing this work that we're talking about and lifting up and celebrating today. I hope it's abundantly clear that these partnerships in Western North Carolina exemplify UNC's service to the state, and that they're creating real boots on the ground impact to improve health, grow the economy, and build regional capacity in these key sectors. So Western North Carolina, we've heard, has the right mix of existing infrastructure, but still has a real need for investment and capacity building. We like to say, or we often say, that we are older, sicker, and poorer than state and national averages. but we're resilient and we're innovative people. With these partners at the table, we can pilot, like Lauren is saying, we can pilot programs in Western North Carolina that inform the rest of the state and the country in key areas like rural health, interprofessional team-based care, the opioid crisis, building entrepreneurial ecosystems, supporting small businesses, myriad other initiatives. Carolyn and I welcome outreach from any of you. We'll be happy to facilitate introductions to our panelists, and we hope that you'll reach out. So thank you for joining us again. Have a wonderful day.
Thank you, Lizzie. And I've just put a slide up that has our contact information, as Lizzie mentioned, and I'm dropping those emails in the chat. We would love to hear from you if you think that we might partner together or just to learn more about the things that are going on. And then finally, as I mentioned, I will advance the slide to this final slide. This top QR code here and link will take you to a survey. You can let us know what you thought of this panel and other Carolina Engagement Week events. And then that bottom QR code and link will take you to the Campus Life Experience credit getting site. I don't know exactly how that works actually, but that's where you need to go if you're looking for that. And as I mentioned earlier, if you have any questions on that, reach out to Margaret Barrett and others with Carolina Engagement Week. So with that, again, thank you so much to Lizzie for joining on this as moderating and bringing people to the table. Thank you, Dr. Mims, Molly, and Lauren. Your participation was really valuable, and I really look forward to continuing this conversation. Have a great day, everyone.